Hi, I'd like to welcome everyone today to my presentation on redesigning the electronic health record, um, the systematic approach. Uh, I'm going to talk about what it would be like to put this process in place at my facility, where we had recently transitioned, well, recently, probably the past couple years now, transitioned from the paper EMR to a electronic medical record. So that's going to be what today's presentation is. So the pieces that we're going to go over today in this presentation are going to be one, the issues that are plaguing the present design, and then what our benefits and goals for the redesign would be, um, considerations for the plan, things that we would like to think about as we're putting the plan together to make it most effective and efficient, the framework for the design, what we're going to be using in terms of organizing our plan, and then methods for the improvement, which will go over some of the different techniques that we could be using to really get the most and best input on the project, and then our summary of where it is that we're going to try to get. So why would we want to redesign our electronic health record? So I know for a fact that our facility, when we rolled this out, this um, what we were using was point-click care, and so we're part of a bigger corporation, and we were sort of one of the last buildings that this got rolled out into. So supposedly a lot of the bugs and kinks in the system had been worked out before we implemented it at our facility. But um, that kind of made me feel a little bit crazy because, I mean, when we rolled it out and started looking at what it was that we were going to be working with, we quickly realized that there were a lot of things in the system that really weren't working the way that we would have liked them to. And that kind of led to some issues with medication errors. I know that at one point the system had a function on it to hold the medication, and it would indefinitely hold these things, even though there was supposed to be an end date to the hold. And it was just an issue with the programming. Transcription errors. So again, that's a situation where it's a human input that's being put into the system for the orders, but there were definitely some glitches in terms of scheduling the orders, times for the orders, the wording that was being used in the orders that ended up causing some issues with the way that the orders were being followed. Um, Also, the text kind of brought up a good point about the lack of the bigger picture, which I think that uh, is an issue with a lot of the, especially new admissions in our facility, where when the nurse is starting to do her med pass or his med pass in the morning, and they're taking a look at what it is that they have in front of them in the EMR, I think a lot of times it gives them very small slices of information about who the patient is and what it is that's going on with them, with not really giving them a very broad picture of who the patient is in one screen. So I think that would be something that would be very important to have and work with in terms of redesigning the EMR. Also, productivity issues. So when we kind of came up with the system and we're rolling it out, one of the things that we were talking about was how this was going to save the nurses time in the day, instead of having to do all the paper charting and going through and working that way. That this would be something that would save them time. And really, in the bigger picture, I think maybe on some level, on some things, maybe there is a time saving component that came through, but in a lot of other things, there was a lot of very monotonous and duplicated documentation that ended up having to be done, that really kind of was a time sucker. So that would be something that would also be a good reason why we would need to have it redesigned. And all of that really kind of leads to this last point of user dissatisfaction. Um, if the nurses and the people that are working with the system aren't seeing a clear positive uh, change for them, it's really not going to be effective in trying to make this successful. One of the studies that I had done some research on and read about did a really good job of presenting both sides of the ideas of the EMR and doing the redesign. But one of the quotes from one of the physicians was that he found that in what it would usually take him 20 seconds to find out what he needed to do, now it would take him 30 minutes in the computer to try to figure that out. And that was because the fact is that the information is not clearly organized or easily accessible sometimes through an electronic health. Another thing that our text does a really good job at pointing out are some of the benefits on both an individual and an organizational level that comes along with making some of these improvements in the electronic health record. On the individual side, it talked about increased productivity, because if you can actually cut down on the time that people are charting, that would be great. Also, if we could fix some of those issues, it would lead to decreased errors, which in turn increases the safety of the electronic health record. And then the last piece that I found really interesting was this piece about the cognitive support. So when you think about what it is that is being presented to the nurse when she's working through the EMR, a lot of times that information is so concise and not, well, I don't know if concise is the right word, but it's limited. And so that limited piece of information really can hamper a nurse's critical thinking skills in terms of trying to figure out the bigger picture of what's going on. So if you can have a system that will, again, present that bigger picture, that can lead to nurses being able to make those decisions on a day-to-day basis for the patient that will be lead to better outcomes. Also on the organizational side, it talked about decreased maintenance costs, which also decreased training costs, decreased developmental costs, and then increased efficiency. So if you think about the issues that are constantly sort of trying to be reworked and fixed and updated, what really that ends up turning into is that every time that there's a new update done in the EMR, it's going to lead to a situation where we're going to have to do training with the nurses and anyone that's working in that system in order to make it so that they understand what the change was and how it works. That is not effective and efficient, and it can lead to more errors and confusion. So if we could have a situation where we would have an updated system that would be working with the users, then we might be able to eliminate some of that issue. And in all of that, that having to not work on developing the system all the time and maintaining and changing the system all the time, that is obviously going to lead to decreased costs and increased efficiency. So the things to consider here are, things that were presented to me through the textbook, which was talking about the user-centered things to consider. So when we're talking about user experience, that's the overall experience that the user is going to have through their own personal history with working in the electronic health record, as well as what they're going to be working with now. It can lead to different levels of understanding and being able to work with that system. And then we're also kind of bringing to that the human factors. Is this someone that has really had any experience working in electronic record? How much computer experience have they had? What are their feelings about working in that kind of environment? So that's something that needs to be taken into consideration. Ergonomics, how comfortable is it, physically for the nurse or physician to work with the system, not just work thinking about the keyboard, but the whole situation of like at our facility, we had to think about what was going to make it so that the nurse who is now having to stand at the cart for a longer period of time to do their charting and documentation through the computer that's set up on their cart, what we're going to do to make that more comfortable for them, and that's been a work in progress. At one point, we had set up a stool that hung on the side of the cart. We ended up having some shorter carts set up to make it a little bit more comfortable for them, and it's still a work in progress. And then the human computer interaction, so that's the actual, comfort level that the person is going to have with working in that system. And is it something that is going to be enticing and let them explore that, or is it going to be something that's going to push them away? And then the goals of usability, which are obviously we want to have it be effective, efficient, and for there to be satisfaction. Here we talk about the framework for the design. The text does a really good job of kind of going over some other different frameworks that really weren't set up necessarily for the health field, and then came up with this one system, the health human computer interaction, which does a really good job of taking that piece and incorporating it into the framework. It talked about the stakeholders, which are the healthcare workers and the patients, and then also that process over time of when they're actually interacting with the system, and where the results would be for those individuals. So here we're talking about step one being at the beginning when healthcare workers are directly working in the EMR and their opinions and feelings about it at that point. And then in step two, talking about how when the healthcare worker is working with the patient, and working in the EMR as well as doing their assessment and how that works out for them. And then step three being the patient and how they're feeling about the overall satisfaction of that experience. So that was a really good way to organize and keep it kind of this idea of the process over time of working in this redesign. And then here we have the methods of evaluation, so now we've come up with the framework, we know what we're going to be working in, we know the pieces that we want to focus on, so what are we going to use as tools in order to accomplish the goals that we've laid out in front of us. And here the text did a really good job also of presenting some different ideas and systems that you can work in. So it talked about this heuristic evaluation, where it's small groups of people, users, sometimes that have different dual jobs where it can facilitate them having a good input on the design side as well as maybe being someone who actually works in the system at the same time. So by having both those things together, it decreased time and cost of the study. And it really, and I was really astounded by that number of 81 to 90% problems were discovered through that system. Also, the usability heuristics, which is a standardized system that there were multiple ones set up, but in the text, it really kind of focused in on this Zhang heuristic and Nelson severity rating, which I thought really laid out very clearly some of the tools that would be needed to be thought about and work through as you're working on this redesign. Also, I think that the ideas of this think aloud protocol and the task analysis would also do a very good job of facilitating having the actual nurses involved in this situation to be able to have their opinions inputted into the redesign process. And then finally, you get to this last piece where you're really looking at what it is that you designed, having it implemented, and then doing a summary and reevaluation of what it is that you've got laid out in front of you to see if it's working the way you wanted it to. And so the text laid out this whole system of user testing, which is a formal questionnaire that is set up, and it's the one that they said was like an industry standard with the system usability scale that made it so that the user would have an independent input without the designer kind of being involved to set a bias on the situation, and then also using a validation test to show that there's retention and working system in place through a standardized comparison in a structured format. And then it also talked about how once you kind of get this process in place, it's really you've got it working, you've got your system kind of set up the way that you want it to, but that constant sort of looking and reevaluation as time is going on will sort of help you keep it from having any issues creep up into it as time moves on. Thank you very much for listening to my presentation today. And hopefully this is something that maybe I could use in real life at my facility in order to help us out with our EMR. Thank you.